Welcome to the Nairobi Health Show with Dave Sherwin and Dr. Ron Ehrlich today. Welcome to the podcast.
Thank you, Dave. Thanks for having me.
I've been looking forward to having you on. I really liked your one sheet. It's interesting. You've got kind of a different angle that you've come from in your background and your medical credentials. And so let me read my bio that I've got provided here to the people listening, and then we'll have you just tell us a little bit more about your background, okay? But first of all, Dr. Ron Ehrlich is a holistic dentist who understands the greater benefits of health that come from taking care of our teeth and mouth better. He's the current president of Australasian College of Nutritional and Environmental Medicine. He's also the author of A Life Less Stressed, The 5 Pillars of Health and Wellness, and also has survived cancer. So you have been a busy guy, becoming a doctor, a writer, practicing dentistry, president of a college. How in the world did you arrive here?
Yes, well, it's a good question. Thanks, Dave. Look, I got into this whole area of looking at the body as a holistic machine, if you like, through chronic pain management. I surprisingly found myself after about a year in dental practice, and I've been in practice for 42 years. After a year in dental practice, I found myself surprisingly treating people with chronic musculoskeletal pain, like headaches, neck aches, pain that people often related as stress-related. And I could see that there were many issues, and I was obviously focused on the oral issues of clenching and grinding. Yeah. But it led me to a broader model of stress, which has informed my professional and personal journey over this time, which led me to write a book called The Life Less Stressed, which I have to add is not autobiographical, it's aspirational for me as much as anybody. So I don't hold myself up as the person who lives a life less stressed. I aim for that.
Wait a minute. So you're not a fully realized human being who's enlightened, ready to transcend this dimension?
I'm just a work in progress, Dave. I'm a work in progress. And, right. So I'm on a learning journey. And, I think you probably realize this, being in health, that's one of the most exciting things about it. And that is, the more you learn, the more you realize you don't know, and the more you have to learn. And if you've got an open mind, you understand how interconnected everything is. I mean, the word holistic conjures up all sorts of new age philosophy of crystals and laying on of hands and all this. It's none of that. It just happens to be the way the human body works, and it just happens to be the way the planet works. And, so a holistic approach is a good one to have.
Okay, well, I agree. And I like that you made that clarification, because it's interesting. Without that clarification, there are people who would assume the word holistic can mean all kinds of things. I hadn't really thought of that. To me, it's a very functional term.
Yeah.
But I'm glad you made that clarification for those who maybe think that it means maybe the opposite of Western medicine or something along those. I don't know.
No, well, I make one correction there, and that is I have been president of the Australasian College for 2019 and 20, and I've stepped off that position. I've been on the board for many years, but one of the things that I was promoting and that the college promotes is a collaborative, inclusive, proactive approach to healthcare. So it's trying to move away from the us and them, us being those that are interested in nutritional and environmental causes of disease, and them who are focused on the management of chronic diseases through prescription medication, etc. I try to move away from this us and them mentality and just say, hey, if we're all interested in public health, let's find out what the best is for public health. Let's stop talking about our egos and what our hobby horses are. Let's just find out what is the best. And that's been my journey as well. So that's what being collaborative, inclusive, and proactive means.
And I love that. But the cynic in me says that some of the people in that arena are making a lot of money. There's a lot of money in cancer care. There's a lot of money in drugs.
Yes.
And so you have a wonderful attitude. The problem is you're trying to collaborate with people who are bringing in trillions of dollars.
Absolutely. Look, the first part of my book's in 3 parts, and it is a journey that I think you need to follow if you're going to understand and get the most out of healthcare. And the first part of the book is understanding the role of the chemical, food, and pharmaceutical industry in all levels of healthcare.
Interesting.
That is from university, research bodies, professional organizations, regulatory bodies, governments, public health messages, right down to the coalface of you sitting opposite your doctor in the doctor's surgery. The role of the chemical, food, and pharmaceutical industry is profound, and it's one of the reasons why our healthcare system is really not a healthcare system, it's a chronic disease management system. And that is a great model. It makes billions of dollars, trillions of dollars, in fact, for all of those industries, including the medical industry and the dental industry, of which I'm part. I'm not immune to that. But the only problem with it is it's not a very good health model. And that is a pretty major problem. So when people, and this is something particularly for very busy health practitioners, it's something that is very easy to miss, because you quite rightly think, I'm going to follow the organizations, I'm going to follow government regulations, I'm going to follow university trials, evidence-based medicine. There is unfortunately a very difficult to distinguish between evidence-based medicine and evidence-based marketing. Well, this is not me thinking
there's
of
a quote.
There's a quote, but that is true. That is actually true. And it's not me saying that. That comes from one of the most cited academics in the world, Professor John Ioannidis from Stanford University. He, if someone writes an article, and I've written articles in journals and I've had them cited 30, 40 times or 50 times, I think I'm a hero. This guy has had his research cited 250,000 times.
Wow.
So he is worth listening to. And when Professor John Ioannidis says, we have a problem, Houston, that is our evidence-based medicine has been hijacked and it is now evidence-based marketing. We need to be careful. So the first part of the journey that I like to take people on is to make them understand that perhaps public health messages are not everything they're cracked up to be. And you could either throw your hands up in the air when you hear that and go, oh my God, I don't know what to believe anymore, I'll just do anything. But the thing I like people to emerge from that with is, your health is just too important to leave to anybody else. I've got to take control of it myself. And that's what my book is about, and that's what my podcast is about, and I'm assuming that's what your podcast is about too.
Yeah, it is. And I want to jump into some of the specifics of oral health and start there.
Yep.
But before I do, and this is a total segue, just for fun, just from my hobby horse, I'm currently listening to Ram Dass. Are you familiar with Ram Dass?
No.
He's one of the early guys. He actually was one of the first experimenters in LSD at Harvard. He actually got kicked out of Harvard in 1962 or something, and went over to the East to discover the meaning of life, right?
Yeah.
And came back. His actual profession, he was a Dr. Alpert, Richard Alpert, I believe, and became Ram Dass in the Hindu tradition, and came back teaching Eastern principles. Anyways, it's a fascinating story. I'm listening to the podcast. Now, one of the things that some people do when they get deep into mindfulness and meditation is when they go to the dentist, they don't use a numbing agent of any kind.
Right. Mm-hmm.
And I wondered if you'd come across that. People that just use meditation as a pain management tool in the dentist chair.
Yes, I have. And I admire them greatly. And actually, actually, for the first 20 years of my life, I wasn't even aware I was doing this, but I probably was. But my dentist did not offer me local anaesthetic. I know.
Didn't offer it?
Didn't even offer it. He must have. He must have looked at me and thought, look, it might hurt my wrist a little bit, but I'm sure he's going to be fine. And they just didn't offer it. So I had quite a lot of dental work done without that. And it is an interesting exercise, and not many patients do that, but some do, and I'm impressed and admire them for it. But it speaks to the definition of pain. and this is really important. It's actually how I got into this, as I mentioned. The definition of pain is this: it's an unpleasant emotional experience caused by the activation of the pain receptors. So there's two parts to pain. One is our ability to regulate it emotionally within our limbic system. And two, it involves the activation of the pain receptor at the site of pain. So if you can control the emotional part of it and facilitate or inhibit the reaction, you will be able to achieve that. It's a really interesting question, Dave.
It's an interesting thing to think about. I'm a meditator, but I'm not there. I'm just going to take the drug when I get there. But I do find it fascinating. And I've had some limited experience with using mindfulness and meditation to manage pain. And I do think there's a lot there. And it's a very interesting topic. But it is a segue, and it's not the major reason I brought you here. But thank you for telling that. It's quite interesting, actually. Guessed you yourself have had lots of dentistry done without. Did they ever hit a nerve and just have you jump towards the ceiling screaming?
Well, that's never happened, but I know that it can happen, and I can tell you from my many years of clinical experience, it's not necessarily the way I would recommend people doing their dentistry, because it is so finicky what we do. So minute, we're talking about microns. And if a patient moves while you're holding a drill in their mouth close to the nerve of a tooth, that's not what you want to do. But patients that have said to me, no, I'll be fine, Ron, I'm just go ahead. And I always say to them, look, there's no prizes for heroes here. So even if you think you're going to feel something, just raise a finger and I will stop immediately. And you can see that finger go up. That's really easy to see. So it's just communication and sensitivity, being sensitive to your patient's needs.
Interesting. Okay. Well, that was very interesting. I'm glad I asked you that. Now, your book, Stress. Now that we've talked a minute, I actually want to back up before we get into some of the things in your book, because you mentioned dentistry introducing you to the world of chronic pain. Now, that's quite interesting. I haven't really heard of dentists kind of going down that track. I've had other interviews on this show about oral care. You're not the first. I think it's a very important subject, so I'm glad to have more. I think it's a topic we need to continually educate people about. But talk about this transition from being a dentist to a pain management practitioner.
Well, actually, 6 months after I graduated, so this was very early days, I had a patient come in as a new patient, and part of my history, they said, I had a crown done here. It's never really settled down. I've had it done 5 years ago, blah, blah, blah. And I thought, okay, I looked in their mouth, I did an exam, I looked at the crown, and I thought, gee, the crown seems a little bit high. I got them to bite on a piece of paper, and I said, that's hitting heavier, I'll adjust that. They came back a week later and I said, how's the crown? And they said, look, it's good. But what's interesting? I've had a headache for the last 5 years. And ever since you've adjusted this, I haven't had a headache. And I thought, okay, that's unusual. I wasn't expecting that. And lo and behold, there was a whole area of dentistry called temporomandibular joint dysfunction, that is jaw joint dysfunction and clenching or grinding, and its impact on muscles throughout the whole body. And that began a journey into what I termed dental stress, and I can talk to you about that. But as I moved into that, I realized actually some patients come in with chronic headaches and go, when I stopped eating this, all the headaches that I had, I stopped. And I had other patients coming in going, when I stopped lying on my stomach at night, my headache stopped. So there was a postural aspect. There was a nutritional aspect. When I moved out of a house, my headache stopped. So there was an environmental aspect, and so on. And so it built this whole stress model, which, as I say, if you've got an open mind, it's a very exciting thing to learn how health interrelates.
Okay, now, earlier on, you clarified the word holistic, and I was glad you did that. Now I want you to do it again with the word stress, because I think the word stress has multiple meanings, and people probably interpret it differently from each other. So seeing as you wrote a book on stress, why don't you start with the definition?
Yeah. Well, most people would acknowledge that stress, they're affected by stress. And hey, is that an understatement in this modern world? But even before the pandemic, most people would have acknowledged that. And they would also acknowledge that it doesn't have a positive impact on their health. Not all stress is bad. Exercise is a good example of stress. Fasting is another good example of a good stress. But let's focus on those stressors that compromise health. And so to that effect, I define a stress as anything that has the potential to compromise your immune system and promote chronic inflammation, because chronic inflammation is the common denominator in all diseases. So anything in life that compromises your immune system and promotes chronic inflammation is a stressor. So for the last 35 plus years, I've had a 5 stressor model. And those 5 stressors, because if you're going to deal with stress, it helps to identify them and minimize them. So if you've got to identify and minimize a stress, it helps to know what that stress is. So I've identified a 5 stressor model. And those 5 stressors are emotional, which most people identify as stress, nutritional, postural, environmental, and dental stress. So emotional, environmental, nutritional, postural, and dental stress. Everybody nods their head until I get to the last one, dental stress. And they think, yeah, I'm with you there, but what's this dental stress business? And I go, look, I include dental stress for 2 reasons. One, I've been a holistic dentist for 40 years, so I feel reasonably well qualified to comment on it. And 2, I include it for anybody with a mouth who is interested in their health, but has never fully connected the two. And there are many connections. For example, it's the gateway to the digestive tract. So if you think chewing your food is an important part, and you don't have to think about it, chewing your food is an important part of the digestive process.
Not everybody understands that.
Not everybody understands that. And I know one of your principles are don't drink your calories. And I think that is such an important point for so many reasons. Nutrient-dense foods usually require chewing. And whether we're talking about vegetables or meats, nutrient-dense foods require chewing. And interestingly, there's even been some research coming out of Sydney University earlier this year, which linked chewing ability to cognitive function, how your brain functions and develops.
Wow.
So yeah, very interesting. So it's the gateway to the digestive tract. It's also the gateway to the respiratory tract. So literally the size and shape of your mouth determines the size and shape of your upper airway. And we have, over millions of years, evolved to have 32 teeth, 16 teeth on top, 16 teeth on the bottom, through and in perfect alignment. And if you have enough room for that, then you will have more room in your sinuses, nasal passages, pharynx, more room for your tongue. So a narrow jaw means you have a narrow upper airway. And if you have a narrow upper airway, you are predisposed to dysfunctional breathing and sleep disordered breathing conditions. So when I ask, and I can tell you now, if I've asked 1,000 people this question in the last few months, how many people have all 32 of their teeth through and in perfect alignment, I think the number would be less than 5%. So 95% of us don't have enough room for all of the teeth we have evolved to have. So we're setting ourselves up for respiratory and sleep disordered breathing conditions. So that's another part of dental stress.
Wow.
The 2 most common infections known to man, woman, and child are gum disease and tooth decay. Over 90% of the population have had some experience with that. That means you've had a filling. If you've had a filling, that means the hardest structure in your body, tooth, has decayed because of what you've eaten or drank. So just imagine what that does to the rest of your body. You don't have to imagine it. Heart disease still number 1, cancer number 2, autoimmune diseases over 100, diabetes, etc. So tooth decay and gum disease. So if your gums ever bleed when you brush or floss, that's not normal. So people have an experience of gum disease. Chronic inflammation, the common denominator that runs through all diseases, the most common side of that is gum chronic inflammation. Because of tooth decay, we implant more foreign material than all other health professionals put together. So the issue of toxicity and biocompatibility of dental materials is important. And then finally, how I came to this as well, they're not finally, but the fact that this is such a sensitive area, the mouth, and if it is out of balance and you clench or grind on that, you will cause problems in the muscles around the back of the neck, which could produce chronic tension, headaches, and neck aches. And then there's a whole issue of oral cancer as well, which is one of the top 10 cancers in Australia, certainly globally. So oral cancer is another one. So when I talk about dental stress, I talk about it for anybody with a mouth who is interested in their health but has never fully connected the two, and they're just some of the issues to consider.
Okay, so I'm going to brag. This is like a podcast host should never do this, but I'm going to brag to you and tell you that I see my dentist every 6 months. I have religiously for many years. And after I get my 6-month checkup and anything done that has to be, that was clean, of course, check out my mouth. And then before I leave, we schedule the next 6 months. I'm seeing my dentist in 2 weeks. And that's been a great habit, probably instilled by my mother, because when I was a kid, she always made sure to take us to the dentist. And then when I got married, we couldn't afford it. We were absolutely broke. And for a while there, we didn't go to the dentist, and then and thought we were fine. But my wife's uncle is a dentist. And one day in conversation, it was something someone else said to him at a party about flossing. And he said, you don't have to floss all your teeth. And people turned and looked at him and said, oh, really? He said, yeah, only the ones you want to keep.
Yeah, nice one.
And for some reason, that little joke stuck with me and made me commit. And I got back to seeing the dentist on a regular basis. Now, what percentage of people do you think are seeing their dentist as often as they ought to?
Well, the report came out recently in Australia, and I think it's, something like over 50% of the population haven't seen a dentist within the last 12 months. And there are a couple of reasons for that. One of them is that a lot of people, including health practitioners, assess a person's oral health by going, are you in any pain? And they go, no. Oh, okay. So oral health, tick that box, no problem there. So that's number one. And the important thing for people to understand is that I believe over 90% of what we see going wrong in the mouth has absolutely no pain associated with it. Right. And can you imagine going in to see a cardiologist or an oncologist, and you walk into their office and they go, hey, Ron, are you in any pain? And I go, no. He goes, great, come back when you're in pain, no problem at all. You just wouldn't think that was a very good assessment. So pain is number one. It's not a good barometer. Number two, this is an incredibly sensitive part of the body, and people are very vulnerable. We're very aware of that as a profession. We're dealing with the most sensitive part of the body while a person is trying to breathe and swallow, trying to do finicky work, and trying to keep calm while we're doing it. So there's a stress level there, which all dentists, I think most dentists in this modern world, are very, very aware of. Yeah. And the third aspect is the reality of the cost involved. And if you came into a dental surgery and spent even an hour or two and saw the equipment and the compliance that goes with modern day dentistry, not to mention the stress level involved in doing the job, you might start to understand why it's as expensive as it is. So they're just some of the things that are kind of blocks to people getting their dental health checked out. But I do believe that having a comprehensive checkup at least once in your life is a really important thing.
Yeah. Oh, I'll say. I'm glad I've been regularly because during that time I've had to have things done. As a matter of fact, when I was a kid, they were putting in those old silver fillings, and happily had those out. And
well, Dave, those silver fillings, which they have been euphemistically referred to over the last 160 years, are actually 50% mercury.
Yeah.
So half the material is mercury, the other half is silver, tin, zinc, and copper. And when I was going through university, it was taught that mercury was locked into the filling and did not escape. And we've learnt that is not true. And then when we learnt that was not true, we then learnt that the type of mercury that escapes is the inorganic type, which is quite safe, which again, strictly speaking, is true until they come into contact with bacteria or microbes, of which there are quite a few in the body, and then they go through a process called methylation, which makes them bioavailable. So it moves them from the inorganic to the organic state. So those silver fillings are what I was alluding to when I said there are issues of toxicity and biocompatibility which we deal with.
And for people listening, if you didn't know this, go to a dentist and get those out.
Carefully.
Right.
Having them out without proper care. And in America, there's a great organization which I'm very proud to be associated with called the IAOMT, the International Academy of Oral Medicine and Toxicology. And they talk about what's called a SMART, S-M-A-R-T, protocol, which is safe mercury amalgam removal technique, because we not only have to protect the patients, we have to protect the dentist and their staff who are doing this all the time.
Yeah, and for those of you listening who just don't think that a tiny bit of mercury does you any harm, it just does. And we know this from the science behind hundreds of thousands of people now having this done. And it's similar to stories you told earlier of people having some dental work done and then having other symptoms alleviate. That's what's happening for millions of people right now, as they're in my generation and older. As they get those out, they suddenly find that chronic conditions magically disappear. Now, you got this whole book, and I don't want to ask you, all 5 of the points necessarily, I could keep you here forever. Instead, I would like to have you discuss some of the top epiphanies you had in writing that book, or what you feel like are some of the most important takeaways you discovered that my listeners would find very interesting. Can you name a few of the things as you prepared and studied and wrote that book that you think are of most interest to listeners and readers of the book?
Sure. Look, I think people do identify emotional stress as an important part of the stress model. And it's rather liberating to learn that actually, while we don't have control over events in the world, and we don't have control over other people in the world, what we do have control over is how we think about those things. So we can change our attitude. Well, that rolls off the tongue very easily and say, look, change your attitude to it, you won't be stressed. What we need to do is have the physical, mental, and emotional resilience which allows us to change our attitude, to make better decisions about what we eat, how we think, whether we move, whether we do exercise, etc. And so the foundational pillar of my 5-pillar model, which is sleep, breathe, nourish, move, and think, the foundational pillar is unquestionably sleep. So unless you are taking sleep seriously, all the other things will become very difficult to achieve. A consistently good night's sleep is the foundation of our dealing with the modern world. And what I mean by a consistently good night's sleep is it's a function of both quantity. So for over 90% of the population, that means getting 7 to 9 hours of sleep a night, which is really important. And it's interesting, on that point, Dave, that people who sleep 3 to 4 hours a night know they're not getting enough sleep, and they perform really badly on almost every health measure. It's the group that sleeps 6 hours a night that are the most interesting, because they're the group that think they're getting enough sleep, but actually they perform just as badly as the 3 to 4 hour night sleep.
That's very interesting.
That is really interesting and very important. So quantity makes a difference, but putting your head on the pillow is not enough. You have to breathe well while you're asleep. And breathing well while you're asleep is an important part of rebuilding, regenerating, rebooting the system, because so many things go out of balance when you don't have a consistently good night's sleep. For example, hormones go out of balance. There's a hormone called leptin, which tells us when we've had enough to eat, and it also helps us metabolize fat. So when you don't get enough sleep, meaning less than 7 hours sleep, your leptin levels go down. So you don't get the message, I've had enough to eat, and anything you eat is going to turn to fat. So number one. Another hormone in the body called Ghrelin, which is produced in the stomach, which tells us we're hungry. Well, guess what? That goes up. So we get a double whammy. In fact, it gets worse than that, because our insulin resistance goes up, which means we store more fat and we become pre-diabetic or diabetic. So hormones go out of balance. Mentally, there's a part of our brain called the amygdala, which is involved in emotions. When we don't get enough sleep, that goes crazy. So we start to have mental health problems. Depression, anxiety are two good examples. Dementia is a thing that is growing problem. Getting, younger and younger people are suffering from dementia. And the drainage of waste in the brain is dependent on getting into the deeper levels of sleep, which is, again, not just about quantity, but about breathing well while you're asleep. Fertility, testosterone levels, our immune system, our DNA, that part of our DNA that regulates our immune system gets down-regulated. So our immune function suffers. That part of our DNA that promotes chronic inflammation, that gets upregulated. So we get more. So there's so much that goes on. So my message is that if you had to start somewhere on a health journey and you wanted to continue on that health journey, you would always take sleep seriously. And to your dentist's point, only bother with that on the nights you want to sleep well and be healthy. So if you don't want to worry about sleep, don't worry about it, but just accept that you're happy not to be healthy, because if you don't sleep well, you're behind the 8 ball right from the word go. So that would be along the way, I learnt many things. It was a wonderful experience, very cathartic to write a book like this. But that was overwhelmingly the message I would share. Now,
amen. And as you already know, I teach my 7 principles that I teach my customers. It includes get 7 to 9 hours of sleep per night. The difficulty is where people do believe it, they understand they're not getting enough. Let me give you the latest example I have. She's a mother with preteen and teenage children. Her and her husband own a gym, and he has another job. So she mostly runs the gym. She has to be there early. So she's got her children, and she can't go to bed really before them. It's just not practical in a family situation. And so she puts the children to bed, and then she goes to bed, and then she has to be up at 4 o'clock, 4:30 in the morning. It's her lifestyle. So I hear stories like this that they, and I don't really know what to say. I'm not a sleep expert. I'm just a guy who believes. I'm a nutritional coach is what I am. I don't have credentials to go in and fix anybody else's sleep. I'm just making a recommendation that I know is based on the latest science, as I imagine you are as well. You're familiar with it and understand the importance of it. But we're not in a place to be making prescriptions, right? Here's the prescription that will solve your problem. But there's just one. As an example. Any ideas? What do you say to someone like this? And there's many similar.
Yeah. Well, I think this speaks to something we refer to as sleep hygiene. We used to, maybe a dentist asking you whether you brush or floss your teeth, and that's oral hygiene, your oral hygiene, very important. But there's also sleep hygiene. And to use your dentist's metaphor, only worry about sleep hygiene on those nights you want to sleep well. What does that mean? There are at least 6 or 7 basic principles of sleep hygiene which are critical. The first one is to prioritize sleep. Now, unless you prioritize sleep, and this is true of your health practitioner as well, if your health practitioner hasn't raved on to you about the importance of sleep, I would put money on the fact that they haven't prioritized it in their own lives.
Interesting.
Okay, so that's number one. You've got to prioritize it, and it is number one priority. It is your built-in, non-negotiable life support system. A quote from Matthew Walker from University of California. So priority is number one. Number two, routine. Routine. There is something wonderful that happens every day since the beginning of time, and that is the sun comes up over the horizon and it sets on the other side of the horizon.
I've noticed that.
Yes, and that's very reassuring.
Yes,
very, very reassuring and very empowering. And it's far more than just that. It's something we should and we have for millions and millions of years. I mean, billions of years almost, since we were single cell organisms, we have responded to that movement of the sun. And that movement of the sun has all sorts of implications to our health. So we have to, A, get into a routine, and we should get into sync with that movement of the sun. Mm-hmm. And the devices we have, on our phones, on our computers, in our LED lighting, this is mucking around with that relationship. So routine is important. Going to bed at the same time every night, getting out in the sun every day, waking up every day at the same time. This is an important part of routine. Then we get on to things like our relationship with light, our relationship with technology, our relationship with noise. Noise is very important, including the noise of your partner sleeping next to you, keeping you awake through snoring. I was a snorer for in my 40s, and I used to dismiss it as my wife's problem, not mine. I kind of go, oh, come on, get over it. What's the big deal? And then when in my late 40s, my wife said to me, it's getting so bad, you're going to have to move out of the room. So I decided to take that seriously. Her problem became my problem because I didn't want to move out of the room, and I did something about it. And I got an appliance which stopped me snoring. And 3 things happened. One, I used to think I slept well until I got this appliance, and I thought, oh my God, I feel so much better. Wow. I thought I was sleeping well, and I sleep so much better. Secondly, because I wasn't making the noise, my wife slept better, and she was much happier and healthier because of it. And the third thing was I got to stay in the bedroom, which was a whole positive I won't go into now. But, so that was really important. So noise is another one. Our relationship with food. When do we eat? What do we eat? Our relationship with liquids. Our relationship with caffeine, with alcohol. Alcohol is a classic example. It'll get you to sleep easier, but it won't allow you to get into the deeper levels of sleep. So that's important. Do you connect with the world doing your Facebook and your emails and all of that just before bed? No, you should not. This is a time to connect with your pillow, not with the world. So this is about sleep hygiene, and I go into that in a lot more detail. I have my own wellness program, and we go into that in a lot of detail. But sleep hygiene is a critical part of that process.
Okay, we got a couple minutes. I'm going to keep you on for one more. Mm-hmm. That was excellent. And one more tip from your book, something you think is really meaningful, could really make a big difference for listeners if they applied it into their life.
Look, I think one of the things, and this has become very obvious from this pandemic too, and that is to express gratitude. Mm-hmm. We live in Australia, and I think this is true in America, but we in Australia have a great deal to be grateful for. If you're fortunate enough to be surrounded by friends, family, or even have a special relationship, in your life, or be a member of the church, a club, whatever, being part of a group and being part of connecting with people and expressing gratitude for that is an incredibly powerful tool, good for your mental health, good for their mental health, good for the world. So I think that's a positive one that I would share.
I think that's beautiful, and I think I agree, and I get it, and I really believe in gratitude, but I'm sure I don't show it or express it or feel it, or I certainly have no program. I know of people that get out of bed, and as they take steps towards the bathroom or to get dressed, whatever they're going to do, they mentally think, thank you, as their feet walk across the floor. And of course, some people pray. I meditate, but my meditation rarely involves gratitude. It's usually just it's just not a gratitude type of meditation that I practice. And so counsel me.
Well, it's interesting, Dave, because part of the sleep hygiene program that I talk about is about, I mentioned this is no time before bed to connect with your emails, your Facebook, or read the news.
Agreed.
Because this is never going to be good, right? So if you are fortunate enough to share your bed with a loved one, finish with 2 or 3 great things that happened. It may be that you just had a great cup of coffee, you had a great meal, what a beautiful day, the sun was shining, whatever it is, however minimal, to do that. If you don't have a significant other, journal it. So literally have a journal, buy your book and go, buy your bed and go, what are 3 things? And they may just be that you went for a walk, that there was a cute dog on the street, whatever. I said hello, I met a friend for coffee. And you reference how long it takes for people to change habits. You quote the work of Philippa Lally, which I thought was really interesting in your ebook, Dave. And she says that it takes 66 days to form a new habit, but it could take even longer. But at least for the next month or 2, practice gratitude as a conscious effort and let it become part of your day.
I'll work on it. For a while, I've done different practices at different times. And I used to use the 5-minute journal. Not sure if you're familiar with that.
Yes, I am.
And it asks you what you're grateful for. And for quite a long time, probably a third of the journal, I did it faithfully, and then I didn't. And it just sat there gathering dust. And then we moved, and it's disappeared probably. And so I kind of start and stop. I just don't. I don't have a real solid routine. So I like the challenge. I will work on it.
And I think getting a consistently good night's sleep, which gives you the physical, mental, and emotional energy to make all of those decisions about how you move, nourish, and think, is an important part of that.
Okay. Now I snore. Now we have a Sleep Number bed, and it has a snore setting. So what happens is when I start snoring, my wife can hit the button and it lifts us both up a little bit. And apparently, I don't know, because I never even know that I snore.
Yeah.
I'm just out. When I go to sleep, and I'm not aware of another thing till the morning. And so she does that, and apparently it is working. She seems happy with it.
Mm-hmm.
But I wonder if I should get one of these appliances like you mentioned.
Well, I think what you should do, and I think this is a really important message for people to understand, snoring is not a social problem. I mean, it is a social problem. It is for the most significant person, I assume, in your life, the person you are fortunate enough to share your bed with. And if you agree that sleep impacts on every single health measure in your body and mind, then getting a consistently good night's sleep is as important for you as your partner. So it is not just a social problem, it's a physiological and psychological problem. Physiologically, snoring means your airway is restricted. And when I talk about a consistently good night's sleep being a function of both quantity and quality, the quality part is an open airway that has the ability to rebuild, to deliver energy to every cell in your body while it's trying to rebuild and regenerate at night. So snoring is not a social problem that you can hit a button. Well, by doing that, you are altering the posture and you are probably opening the airway. Okay, so that's probably a positive. But, for anybody over the age of 40 who is snoring, and actually I had a patient in just this week who was 29 years old, woman, not overweight at all, had a sleep study done, and that's an important thing to look at, just like having a comprehensive oral exam. And by that, I mean more than just look in your mouth and go, oh, yeah, that looks fine. Okay. I mean a comprehensive oral exam.
Yeah.
Just like that, I think a sleep study for people that are tired and sleeping and not waking up feeling refreshed is important. So this woman who's 29, not overweight, young woman, fit, healthy, had a sleep study done which showed that she had mild obstructive sleep apnea.
Mm.
And what we did were two things. We changed her sleep position, which is to your point, Dave, about the postural changes. She was sleeping on her stomach. We retrained her to sleep on her side. And we also encouraged her to place some micropore tape on the mouth at night to promote nasal breathing. That's another aspect to breathing well, because when we say you've got to breathe well while you're asleep, the obvious question is, what does that even mean? What does breathing well mean? I'm still alive, aren't I breathing well? No, there's a big difference between just breathing and breathing well. And so what she did was, when she had tape on her mouth at night, it promoted nasal breathing. It forced her to breathe through her nose at night. Now, not everybody can do that. You put tape on while you're sitting watching a TV program or on your computer. If you put tape on your mouth and you breathe slowly through your nose, one of three things is going to happen. Either you're going to breathe comfortably through your nose, in which case, great, you can use that at night. You think your nose is blocked and you don't think this is going to work, but you put tape on your mouth, and after 5 minutes, as the body chemistry corrects itself, it starts to open up the airway. That's the paradox of breathing through your nose. Your body produces something called nitric oxide in the nasal passages, which is a natural bronchodilator. So noses that were blocked, unblock. And the third alternative is you put tape on the mouth, and after 5 minutes you're struggling and you think, oh my God, I can't breathe through my nose. Don't try that at night. Go and see a doctor about why your nasal passages are so inflamed and swollen that you are unable to breathe through your nose. But that thing, changing her sleeping position and giving her tape, moved her from mild to moderate obstructive sleep apnea to perfectly fine sleep pattern.
Wow.
Just by making those two changes. It doesn't always work as easily as that. But that was just
a very, very interesting idea.
Yeah.
What's that tape called?
It's called micropore tape. It's a 3M product. I have no shares, but it's hypoallergenic, very thin. And my one hint to that would be, never pull it off in the morning. Always poke your tongue out and peel it off. But there's another product. Now companies, we've been doing that in our practice for the last 15 years. But there's now companies that are doing various things. One's called SomnoFix, SOMNO Fix. You can get that online, and another one called MyoTape. So a lot of companies have now come on board, and there's some great research to support that. I should send you our brochure that we share with patients on that very issue.
It's terrific stuff, and not a direction I thought we'd go based on your bio and everything. But obviously, you've intrigued us all with what you have shared from the book. Tell us again the name of the book and where people can find it.
Well, the book's called A Life Less Stressed: The 5 Pillars of Health and Wellness. I think you could get it from any bookstore. It came out in America, in the US in 2019. It came out in Australia and the UK in 2018, and it's actually, I believe, coming out in Turkey in the next year or so. I don't think I'll be doing the Audible version of that one, but I have done the Audible. It's available on Audible as well.
Oh, is that right?
And Kindle.
Okay, excellent. And how can people learn more about you, or what do you have to offer? What people get from you here?
Well, I have my weekly podcast, Unstressed with Dr. Ron Ehrlich. But we have our online wellness program where we explore, it's called the Unstress 5 Pillars of Health Wellness Program. And the Unstress is all about understanding stress, identifying and minimizing that, and building resilience through the 5 pillars. And they can find that on my website, Dr. Ron Ehrlich, DRRONEHRLICH.com. We're just about to launch a new Unstress 5 Pillars of Health site. So that'll be up, and there's an app you can get on the App Store, Unstress with Dr. Ron Ehrlich, and you'd be up to date on all of that.
You've been busy.
I've been very busy.
That's a lot of work.
A lot of work, but it's good. It's fun. I enjoy it. And, that's the other thing. It's not what you do that is perhaps stressful. It's how you think about it. So if I thought all of that was really stressful, I wouldn't be in very good health at the moment. But I feel like I'm enjoying excellent health, despite 1 or 2 setbacks in my life. But hey, we live in the modern world, and, I'm not perfect.
Well, I can tell you enjoy what you do. You're passionate about it. You're knowledgeable. It's been a really interesting episode. And thank you so much for coming on.
Dave, thank you so much for having me.
Okay. And to those of you listening, this is Dave Sherwin wishing you health and success.